Why don't you start off by telling us a little bit about the problem, first of all? What is the shortage looking like in Canada when it comes to doctors and nurses?
Absolutely, Colin. I mean, anyone who's tried to get a hip or a knee surgery knows that there are lots of problems in Canada's government-run health system. There are long wait times and there's lots of inefficiency, and the staff shortage is definitely a big part of it. I mean, first off, it's kind of a common sense thing, right? If you need to get care, someone needs to be there to provide it for you. So, for instance, in Ontario, the government there says that if things don't change in the right direction, they'll be short 33,000 nurses by 2027 in that province alone. A survey last month showed that 1 in 5 Canadians don't have a family doctor. That's over 6 million people. So that's a really big deficit. It means that if emergency rooms aren't fully staffed, nurses and doctors are overworked, and patients, they can't get the care they need in time. We're even seeing emergency rooms completely shut down because of the staff shortage. Earlier this month, the ER at the hospital in Carleton Place, Ontario, just outside of Ottawa, had to shut down for 16 hours straight. They didn't have the staff to keep things running. So imagine you have a heart attack or you get hit by a car or something like that. You want the emergency room to be staffed and able to take care of you.
I know when we were working on this research, some of the numbers were eye-popping. 6 million Canadians without a family doctor. Obviously, that's going to have an impact when people can't see their family doctor. They often go to emergency rooms, and that's putting more pressure on emergency rooms. You've been looking at a lot of patient stories. Are there any stories that really stick out in terms of the consequence of this shortage of staff that we have?
Absolutely. I mean, the one that stuck out to me the most, Colin, the very worst thing that can happen is it's causing some patients to lose their lives. On New Year's Eve, actually, in Nova Scotia, there was a mother named Allison Holthoff who she started feeling some sharp pains in her stomach. Her husband took her to the ER, and she had to wait for 6 hours before staff could even get her in for an X-ray. But by that time, it was too late. She had already started to go into cardiac arrest, and she died that night and left behind 3 children. It's absolutely tragic when you hear about a story like that. Even if it's something that's not life-threatening, the staff shortages can contribute to long wait lists for important surgeries. As one of the many examples, last summer in Winnipeg, the health authority there had to delay over 300 surgeries because they didn't have enough anesthesiologists. So, even if those aren't necessarily life-saving surgeries, your quality of life is going to suffer if you have to wait an extra few months for, say, a hip replacement. So it's, the staff shortage really ties into a lot of these problems.
I know it's brutal, the stories that are happening in Canada. We hear them all the time. It seems like everyone has a story that they can share, whether it's a personal story or a friend or family member that they've heard. It's a lot of stress on patients right now. I want to ask you about the research. Tell us a little bit about the findings and big picture, looking at the number of these states along the border that have issued licenses to Canadian doctors and nurses.
Yeah, it is really interesting, Colin. I mean, you hear a lot about governments who are trying to hire healthcare workers from other countries. But yeah, it might be surprising to hear there is a really big source of staff right under our noses. Just in states along the border, there are nearly 10,000 doctors and nurses with a Canadian address and a license to practice in those states. And that's actually a bit of a lowball because North Dakota, Minnesota, and New Hampshire didn't get back to us with any data. So 10,000 nurses and doctors, that is a pretty significant chunk of staff that if at least a significant portion of those were convinced to continue to work in Canada instead of working in the US, it certainly would help with the staff shortage.